Cooperation in healthcare, a call for unity. Hi there, I'm Yaz, an osteopath, physician associate, acupuncturist, and the lead at the Shockwave Centre here in Town Osteo in Leicester. I work in private sector, and today I want to talk about or share a story that highlights a growing challenge we face in healthcare, a gap in cooperation between regulated healthcare professionals. This gap isn't about knowledge or resources, but about communication, collaboration, and human decency. A patient came to me with pain in the lower back and hips. Despite treatment, the pain persisted, and in about 10% of cases are recalcitrant, i.e. they don't get better. In these cases, we need further input from the medical specialties. We need imaging, bloods, and sometimes some specialist advice on how to pinpoint the cause. In this case, the patient had private healthcare insurance, a real win-win. It allows faster access to care while easing the NHS demands. But when I referred the patient, the GP insisted on seeing them first. Of course, getting a GP appointment can take quite a number of weeks. The patient described the encounter with their GP as frosty, feeling dismissed and even berated. After a brief examination, the GP asked, "What do you want?" Thankfully, the patient stood their ground, pointed out my referral request, and eventually the GP relented. They agreed, but this raises several questions. One, why are patients sometimes treated with such dismissiveness? Two, why assume other healthcare professionals don't know what they're doing? Three, why don't we just pick up the phone and collaborate with each other? And four, if you continually exclude healthcare workers and deliberately make their working lives impossible, then of course they will eventually fail. And that's a self-fulfilling prophecy. Imagine the benefits if we put patients at the very center of care, where all regulated healthcare professionals can work together seamlessly, motivated by a shared purpose and commitment to providing the best possible care. Collaboration can streamline care, reduce GP and hospital workloads, and ensure patients feel respected every step of the way. The UK healthcare system relies on allied healthcare professionals. Expecting GPs and hospital medics to handle everything medically related is unsustainable. It would quadruple costs, increase waiting times, and I would argue reduce quality of care. There's a brilliant article by the World Economic Forum a few years ago highlighting these principles related to economic monetary models, and this really applies to healthcare too. Let's focus on solutions and end interprofessional conflicts. By working together, we can create a system that is cohesive, compassionate, and cost-effective, safe, fast, and truly centered on patient care. Thank you for watching, and let's continue working towards a healthcare system that puts patients in the center. Thank you.